Have you been struggling with managing your medication and you didn't know how to get help? Are you confused about the medications that you take? Do you have a chronic condition, as in an illness that's likely to last 6 months or more? And does that illness require some help with some allied health team members? You might qualify for what we call a GP chronic condition management plan. Good day, I'm Dr. Tia, and today we're talking chronic condition management plan, a facet of Medicare. A chronic condition management plan is the Australian government acknowledging that often people who have chronic conditions require specialist intervention, whether that is allied health or non-GP specialist, to help in managing their healthcare. As a result, the costs to see those people can become a bit much. And to reduce the cost being a barrier, there are programs such as the GP Chronic Condition Management Plan, which allows the general practitioner to coordinate a team and by utilizing that, propose a referral to allied health specialists to have 5 subsidized sessions per year. This goes per calendar year. And so as a diabetic, for example, you might need to see a podiatrist, an exercise physiologist, a dietitian, just to try and keep your diabetes in check. And therefore, the Australian government, rather than having you pay exorbitant amounts to see these individuals and eventually deciding that's just too much, helps us as a general practitioner coordinate your care and involve those people for you to qualify for 5 subsidized sessions per year. Often patients present and say, oh, I need the things, so I can see the podiatrist for free. There is nothing for free. I want us to move away from thinking they're free items. There's nothing for free. It just means that if it's free, that you're not the one paying for it, but someone somewhere is still paying for that service. So that is a chronic condition management plan. Other services that might be of help if you have a chronic condition might be what we call a home medication review. A home medication review can be brought on by a doctor if there are challenges in managing your chronic condition, to involve a pharmacist in ensuring that the current medication that is prescribed is what is being taken, that patient education about why the medication is being taken is there, and that patients are adhering to it and there's nothing working against us like complementary therapy or anything like that. A home medication review often involves a pharmacist coming to your house, going through your medication cabinet and making sure it's safe and that how you manage your medications is in a safe manner. And then checking that the education regarding that medication is adequate. Pharmacists are very talented and can also acknowledge when medications are clashing or when medication should be deprescribed because someone is a bit elderly or their organs are not happy. So that's the role that pharmacists play in ensuring that patients who have chronic illness, chronic medical conditions, can be safely managed at home. A home medication review can also advise the general practitioner if your management of medication is subpar, which might then involve the pharmacist starting what we call a Webster pack or a dosette box or form where they pre-pack all medications for the patient so that we can be adequately sure that medications are taken as prescribed. These are some of the outcomes that might come from a home medication review and a GP chronic condition management plan. The chronic condition management plan and the home medication review are meant to be triggered by your GP. They are meant to be initiated by your GP, who writes a letter to the pharmacist or who writes a letter to the podiatrist to just say, hey, I'm seeing Joe and I would appreciate your input into Joe's care. So if you think you might qualify for those, just inquire with your own general practitioner to see if you qualify for any of these services. Till next time.